Hello and welcome to Health Matters on Channels Television. Thanks for staying with us. I am Mary Alale Yusuf. There were more than 5.9 million confirmed cases of COVID-19 all over the world as at May the 30th. Over 2.4 million people had recovered from the viral attack, and there were more than 365,000 deaths. The USA had more than 1.7 million confirmed cases, representing about 29% of all cases, and well over 3 times the number in Brazil, the second hardest hit country. In Nigeria, at the same time, there were 9,302 confirmed cases, 2,697 recoveries, and 261 deaths. Lagos State had the highest number of cases in Nigeria, with 4,377 cases, representing 47% of the country's caseload. Kano had about a quarter of that, and the second highest number of confirmed cases in Nigeria. My guest is a public health physician and a member of the Association of Public Health Physicians of Nigeria, Dr. Doyin Ogunyemi. You are welcome to the show.
Thank you for having me.
Doctors are telling us that this is the new normal. We should get used to COVID-19 for the long haul. So how are we going to live in this time? First of all, I'm concerned about people who are afraid to go to the hospital for 2 basic reasons. First, some of them say, what if I go and I'm told I have COVID-19? Like, you know, it's the standard thing. I go to the hospital, they say you have COVID-19. Then the second group are saying, what if I go there and they give me COVID-19? How are we to address that in these times, since we're supposed to get used to this?
Okay, so first and foremost, we cannot be on lockdown forever.
Correct.
We've had it for some weeks, and we've looked at the benefits versus, you know, what we're losing by staying back at home. So it's real. The fear is real because truly, you have less chances if you stay at home than if you go out. If you really have no business being in the hospital, please do not go there. So for instance, in some hospitals, no visitors. Somebody gave birth, I want to go and greet. That's out of it.
Okay.
But if you do truly have a need to visit the hospitals, some steps some hospitals have taken is to first provide telephone numbers.
Okay.
So you can first call the number and you have a bit of, somebody speaks to you, asks you questions, and then see if there is a need for you to physically come to the hospital. If it is what can be taken care of outside of the hospital.
Over the phone?
Over the phone, maybe through some prescriptions, and you get to a drive-through pharmacy and you can get it, that's fine. But you must come to the hospital if there is a need to be there. Maybe your immunization is due for your child, or as a pregnant woman, you have one of the signs that in labor that shows that you may be in danger, or you have your antenatal care. Let us know that the hospitals too are doing a lot. These hospitals have health workers that work in it 24 hours. So they're keeping it as safe as possible. What the hospital does not want is a crowded reception, for instance. So we're all used to seeing crowd as good, you know, in Nigerian setting, that there's a lot of people here, it means this is good. We don't want that. And so they're looking for ways to make sure that people are not infecting other people. So do not hesitate to come to the hospital. Do not miss your immunizations if you need to. Get phone numbers, call the hospitals ahead. For public hospitals, it may be a bit different, especially at the health centers. But I know that even there, you see things like canopies outside of the hospital.
Okay.
And then
that's at the PHCs? At
the PHCs, to allow, where there's a lot of space especially, and some of this is the community effort or the health facility effort, to allow people space and sit down such that they are not too close to each other. Where we should actually be going is scheduling visits for people, ideally, so that we are able to know what is an emergency and what is not an emergency. If you're not an emergency, you have scheduled visits, and we should have probably morning clinics, afternoon clinics, and possibly evening clinics. Because of some other infrastructural issues, that may not be that easy. But that is where we should be going. So embracing the new normal is, we cannot stay where we are. We have to innovate. So these are the problems of this. How can we confront it and fight it so that we have a safe environment for everybody? I feel comfortable as a patient to come to the hospital. I also feel comfortable as a healthcare provider for people to come into the facility, because I've put systems in place that ensures continuous making sure the place is well sanitized and making sure it's well disinfected. If everybody is on the same page that way, we will move from that place of fear and flight to actually fighting COVID-19 and moving on.
And getting on with the rest of life.
Yes.
A number of women complained to me that they went for immunization appointments for their children. You know that immunization is actually an appointment. They tell you to come on a certain date. And they were turned back and given other appointments, and they did not understand why. Now, I can understand, from your explanation that maybe they were given other appointments for the decongestion of the space. But, they need to be told these things so that they can understand. And they're also afraid that if my child doesn't get her immunization today and she doesn't get it next week, perhaps she's going to be in some sort of danger, because there's a timing for each immunization. So what do you have to say about that?
First and foremost, we mustn't lose the gains that we have made over the years in terms of immunization. If you look at statistics over the years, we'll see that there's a lot of improvement for completed immunization in children under 1. Because we cannot trade other epidemics, such as having measles epidemic or resurgence of polio and so on and so forth, because we are afraid of COVID-19. So I don't think any health facility should turn back for immunization. Rather, what we should quickly do at the facilities to devise ways where we can, again, stagger appointments. If, for instance, it was only one day that was used for immunization before, say Wednesdays, so that you can pool children together. This is the time to also be flexible and say, okay, maybe we can now do Monday, Wednesday, and Friday, so that we can have fewer children coming at a certain day, or we can give timing. So again, it's about us looking at what we have in place and trying to adjust
How does that affect the immunizations themselves? That's the solution, which they say, oh, we brought out such and such a number for today and it's all gone, or, we can't keep it to such and such a date. Is there any such thing?
There's a cold chain, and we have to just ensure that at every point in time, what you give is valid, and there's a way to check that, which, of course, the health workers know. But there's also a time frame within which children must get their vaccination. Yes. Birth, 6 weeks, 10 weeks, 14 weeks, and so on. So even if there's a bit of a change in terms of days before, days after, that's still fine. But I know that, even the National Primary Healthcare Development Agency has appealed, and given support to say, please, let no child miss their immunization. We may need to trade something. So something like a BCG vial that you need almost 20 children at once. When you open one, then it's for 20 children. If you don't complete it, you still have to discard. So we have to think about that, but possibly not at the risk of not giving the child BCG immunization. Yes.
That's why it's important to have that canopy.
Yes.
That would help.
Yes, that will help. During the Ebola crisis in DR Congo, at the time they were relaxed on vaccination, and then they had an epidemic of measles. Oh. We don't have the facilities to grapple with the ongoing pandemic of COVID and then an epidemic of measles. So whatever we have to do, we have to train healthcare workers to protect themselves. We have to also tell mothers to please take their children for immunization. And we also have to be more flexible in terms of how we deliver immunization. If we have to give some other services out of that confine, let us plan to. let us also make calls to mothers. And some of the primary health care centers already do this. They know those who are to come for immunization because their card is waiting, and they can call them up when they do not show up for immunization. We can't trade that at all.
Yeah, that's good. Now, they talk about herd immunity. To me, it's like reverse herd immunity. We know about giving people lots and lots of polio vaccines. So the majority of those who have the vaccines protect the others who might not have the polio vaccines. But in this case, they're saying we're going to achieve herd immunity in COVID-19 without a vaccine. How and when are we going to achieve this?
So in the strictest sense, we won't call it herd immunity because herd immunity, like you said, is mostly from the fact that you've given a large proportion of people vaccination. And with each disease, you know what proportion you need to give that then protects others who may not be immunized or who are unable to, but are still protected from that disease. And lots of literature has looked into this. And they've also made calculation in terms of how many people would have to have COVID for us to achieve herd immunity, okay? And from the calculations, if that proportion of people have to have COVID, then we're also going to be ready to have a lot of, some mortality. Our mortality rate has stayed at about 3%.
Yes.
Okay? But if we do 3% of a larger
That's a lot of numbers.
That's a lot of numbers. So, we're waiting and we're hoping that it's more of mild diseases, which seems to be the case, more of asymptomatic diseases, and people are being immunized in the process, hopefully. Even at that, they're still watching that to see how much. To a large extent, they're saying you can't really get reinfected, but they're still looking at that. I don't think we should say do nothing, as it were, and say, let's just wait for herd immunity to catch on because of the mortality that may follow. You'd also want to control the number of people that are sick at a certain time.
Because of the spaces.
Because of the spaces. So that balance in ensuring that not too many occupy that sick role, even at home, even if they will not come to the facility, if there are 5 people in the family and 4 are sick, and they have to stay in bed or stay isolated, who then cares for the others? So to a large extent, we just must slow the entire process of the spread, looking at how many people one person that is infected infects, and keeping that to less than 1 person as much as possible.
That's why our masks are still important. Our social distancing is still important.
And our hand washing is still important.
Let's take a short break. Please stay there with us. We are coming back in a short while. Welcome back. It's still COVID-19, the new normal we're discussing, and this is Health Matters. Please call any of these numbers if you or someone you know has a fever or other symptoms of COVID-19. That's it there. The numbers are showing on your screen. You can call any of these numbers from your home to help decongest our health facilities and also help the response to COVID-19. Those are the numbers there on your screen. All right. So if you want to ask questions on this show, the number to call is 0805-468-3514. It's showing on your screen, 005-468-3514. You can also tweet at CTV_Mary A. They say that we should be, the best defense is preparedness. What will our health system look like, our health sector look like, and our response, emergency response, when COVID-19 finally goes? Because right now, everybody is putting everything into it. But when it's gone, are we going to be hollowed out? What's it going to look like? And what can we do to make it what it should be?
What it will look like depends on us. Because when Ebola came and everything was, please, hand washing, let's put taps here. And then Ebola didn't stay long enough. And because of that, when Ebola went, we seemed to go back to normal. Again, COVID-19 is not going as quickly as Ebola. And so what we make of it is what it will be. When you say health system is not just structures of health facilities.
That's right.
Health system is from health beliefs. What do I believe about diseases and illnesses? Health system is about behaviors. What is my preventive health behavior? What is my sick role behavior? What do I do? Am I curative in nature? Am I preventive in nature? Health system is the primary healthcare center, the public, the secondary, the tertiary health center. It's the other organizations like what the NGOs are doing, what the traditional medicine is doing. The health system is the policy that is being made. It's the political context, the economic context. It's what are we going to fund? How are we going to fund healthcare? Are we still going to stay at less than 5% to be spent
That's a big
on
question.
health? Or are we going to improve on what we spend on health? What is healthcare financing? Will financing remain out-of-pocket payments, which is what it is in more than 60% of the population? Or would we go into lots of health insurance and make sure there is more coverage? So what it is post-COVID is what we make it. If the borders are open and people can fly out when they're ill, then are we going to go back to leaving the health system to rot? Remember that the COVID has made sure that nobody can leave the confines of the space. So if you will get the best within here, and if the best within here is not suitable enough, then we see the repercussion of that. So the health system is a lot of all this, especially governance and leadership. What it will be post-COVID is what we decide is important to us. If we think that health sector reform is important, then let us, put our money there. Let us put our energies there. And that is what it will be. But it has really shown the gap. The other time, the task force chairman was saying that he didn't know that things were this bad. He said that. He did not know that things were this bad. And so COVID has shown that we were really, really on a fragile health system. If we didn't know before, everybody knows that it was so fragile. We know that we need to expand services. We can't have the same number of institutions that we had 10 years ago now with a growing population. So what it will be again is what we decide is priority. If we think it is priority, then it will get better. And I pray that we get the benefits and we don't lose that.
Let's quickly take this call from Doyin. Hello, Doyin.
Yes, good afternoon. My name is Doyin. I'm calling from Lagos Island.
You're welcome. What's your question?
Fine. Thank you for the program. We really enjoyed the program. And my question is concerning those that are on family planning, particularly on the implants. And it is due, actually. I'm supposed to remove it. And I went to the hospital. I was already told that they can't attend to minor surgery. So my question really is, what is the effect? Does it have any effect on me being there for a while now?
Okay, thank you very much, Doyin. Very good question there. What's the effect if the contraceptive is left inside beyond the time? Because they said they can't attend to minor surgeries. I guess it must be the under-the-arm implant, yes.
Oh, I think that she should be attended to. So if possible, she should try again now.
Okay.
The initial response to the COVID was a lot of facilities were shutting down outpatient services and leaving emergencies. But trust me, the opening up is starting again.
Okay.
Now, the effect is that it what should normally release the hormones that prevent pregnancy, that amount has reduced if it is already, I don't know which one she used, the one for 3 years or for 5 years. So it means that she may not be protected by what is still under.
Which means she may get pregnant.
Which means she can please use an alternative during this period. Please use a condom during this time or any other way to protect yourself, because that is no longer protecting her. It's not going to cause any damage, but it's not protecting her. But please try again and ask. It's not a very long procedure. That when can you come in to have it removed or changed? And it's true. Family planning at this time, people are at home. And we're talking about controlling population. I mean,
and it makes for more babies to be at home all together.
With the season is changing, the weather is becoming cooler these days. So we really have to look at family planning. Already we're short on family planning. 15% of women have access to contraceptives. So please go to, if the facility cannot find another facility, you don't have to remove it in the same facility. And you can be attended to and given another contraceptive that will protect you.
Okay. We are getting a call from Enugu. Hello. Hello, Emenike.
Good morning.
Good afternoon. What's your question?
Good afternoon. Good afternoon. Good afternoon.
Good afternoon. What's your question?
Good afternoon.
Hello, Emenike.
My wife is pregnant.
Okay.
I say, let me introduce my TV set, please.
Put it off.
I'm hearing you. I think you are hearing me now.
Yes.
I said my wife got pregnant. She's pregnant. And he's still having headache. Every time he's still having headache. So I will go to hospital and they're giving her drugs. And headache still keep on worrying her. I want to know what I will do.
Okay. Thank you, Emenike. That is important because of COVID-19, right?
So ordinarily, they would have just walked into the hospital, but now every time you have to take a decision to go to the hospital, you're asking yourself, should I, and all of that. Now, I don't even know how advanced she is in pregnancy, but headaches in pregnancy can be
it's not good.
Dangerous, preeclampsia, and so on and so forth. So she should go back to the hospital or call a healthcare provider, okay, and ask what should be done. Obviously, they want her to check her blood pressure. They want to check if her legs are swollen. They want to know how far gone she is in pregnancy. They want to know if it's the first pregnancy, second, and the history of previous pregnancies. So,
okay, finally, before we go, Ogochukwu is asking, has it been confirmed that COVID-19, a bout of it, now makes you immune for life?
No, it hasn't been confirmed. To a large extent, they say anything that is seen as a trace is not infective from that person.
All right. Yeah. We really have to go now. Thank you so much for coming. But before we go, please go to channelstv.com/podcasts from June the 1st to enjoy an audio version of our show.
Oh.
Thank you. We won't be needing that now. But again, go to channelstv.com/podcasts from June the 1st to enjoy an audio version of our show. You can do that if you missed the show or if you just want to listen in again and get some points. Thank you so much for being with us. Thank you, Doyin and Emenike. Have a lovely day.